Today we're talking about bowel health while using opioids. Just a disclaimer, opioid-induced constipation is a diagnosis you can receive from a provider when you're prescribed opioids. That provider might be able to prescribe certain medications to address the opioid-induced constipation or maybe prescribe you a different opioid that's not causing similar issues. But today we're going to be talking about low barrier harm reduction ways of addressing different bowel issues when using opioids. So not opioid-induced constipation, but just general bowel health to make sure that you're avoiding any discomfort like constipation or other GI issues. So how do opioids affect the GI system? Opioid receptors are found in our central nervous system and our GI tract. Those opioid molecules can affect things like fluid absorption in our GI tract, sphincter contraction, and motility. People that are experiencing opioid-induced constipation or just different GI things from using regular opioids say they report feeling anxiety, frustration, and depression. So what are some of the other symptoms that people experience in their GI tract when they're regularly using opioids? Research has shown that asking someone the number of bowel movements they've had in a day or a week is a poor indicator of maybe all the other GI things that they're experiencing. You can ask questions about like gastric reflux, are they having constipation, are they feeling fullness, and the fullness is not going away in a normal amount of time, which might mean they're having some kind of like backing up issue. Are they having like regular burping? Are they straining, abdominal pain, nausea, vomiting, dry mouth? So there are a lot of different symptoms that someone could be experiencing. So it's important to ask a variety, and right, our GI tract starts at our mouth and ends at our anus, and there's a lot of in between. So ask about all those other GI symptoms they could be experiencing. So how do we know if someone's having GI issues when using opioids? We need to ask them. People said that often they are not asked questions about GI symptoms when using opioids, or they just lack information in general. And these GI symptoms can lead to unnecessary provider visits or just other complications in their life. So ask. So what are some of the first steps that we can take if we're experiencing GI issues when using opioids? Basic lifestyle changes, or just making sure that you're drinking plenty of water. That's 8 to 10 glasses a day, 8 ounces are in a glass. Making sure we're eating a bunch of fiber-rich foods, which we'll talk about soon. Getting physical activity. Physical activity helps with our mobility in our GI system. Giving ourselves time in the bathroom, right? It's easier said than done, but try to give yourself time to actually release what's in there. And then routine. Routine helps us, our bowels get reset. So what are some different fluids that we can take in when we're trying to address our GI issues caused by opioids? Definitely encouraging fluid intake of water, 8 to 10 glasses a day, 8 ounces in a glass. We can drink warm liquids like senna tea. Senna tea is a stimulant laxative, so that might help push things through quickly. But we can also do hot water, tea, coffee. We can also do prune juice. So what are some foods that could help with our GI symptoms caused by opioids? Foods that have fiber, things like beans, oatmeal, popcorn, which is nice, fruit and vegetables. The fruit could be like apples, whether it be the juice, the sauce, or the actual fruit. You could do prunes, whether the juice or the dried fruit, orange, berries, or bananas. And then for the vegetables, it could be things like peas, green beans, cabbage, broccoli, different greens, all help things move along. So now we're going to talk about over-the-counter options that you could use to help with some of the GI symptoms or constipation. We're going to be talking about fiber supplements, stool softeners, laxative, both osmotic and stimulant, as well as enemas and suppositories. So now we're going to talk about fiber supplements. People might be familiar with things like Metamucil. Metamucil is a fiber supplement. This is just a powder that you add to water, stirred around, take it in. That is a good way to get fiber. It's a very gentle over-the-counter way to get your fiber to help with constipation. It does, if you're using it maybe for the first time and having a lot of GI symptoms, it can cause gas and bloating. Now we're going to talk about stool softeners. Stool softeners are exactly what they say they are. They are softening your stool to make it easier to pass. They are very gentle and along with fiber supplements should make it easier to pass a stool. They can cause a little bit of cramping or nausea. Now we're going to talk about two different types of laxatives. We're going to talk about stimulant laxatives and osmotic laxatives. Now we'll talk about stimulant laxatives. It's in the name. It is stimulating the bowels to have a bowel movement. It does tend to work quickly, which it'll say on the instructions, and it can cause some abdominal cramping and some discomfort, so just anticipate that. Now we're going to talk about osmotic laxatives. Osmotic laxatives pull fluid into the intestines to hopefully push and move a bowel movement. They usually come in a powdered form like Miralax that's mixed with water. With any of these laxatives, it's just important to remember these are not chronically used. You shouldn't be using these regularly because they could cause electrolyte imbalances or your intestines could become dependent on that laxative to help cause a bowel movement. Now we're going to talk about enemas. Enemas are when you inject fluid into your colon from the rectum to hopefully stimulate a bowel movement. There are many types of enemas, so check out which one is correct for you. You could talk to your provider about that. But just be careful that sodium phosphate enemas can cause electrolyte imbalances, so might not be good for people with chronic kidney disease. Now we're going to talk about suppositories. Suppositories usually come in like a little white pellet that you insert into the rectum that melts and then stimulates a bowel movement. It's usually easier and a little safer to use than an enema because you're not sticking a foreign object into your rectum and squeezing, maybe causing injury. And again, it's important with any of these over-the-counter remedies for constipation or other GI issues you're experiencing when using opioids. They shouldn't be used every day or on a regular basis. They might be masking another issue, or they might cause reliance or dependence on that medication to have a bowel movement. Lastly, we're going to talk about colonoscopy preparation. You might be ordered a colonoscopy for a variety of reasons. This is when they stick a tube up your anus to look at your colon and your GI tract. Usually the standard is a one-day prep where you're not eating or drinking anything but clear liquids, as well as taking something to help stimulate your bowels. It is recommended that if you are chronically using opioids, that you should probably do a 2-day prep to have the best clearance of all the stool in your system. So when they do go up to check your bowels, that it's clear. And just a reminder, it's important to know that individual experiences may vary, and it's recommended to consult a healthcare professional if GI symptoms and/or constipation persist or is severe.
What did we learn in the GI health video? We said, what is the best first step when talking to someone who regularly uses opioids? If they are having any of those GI symptoms, and we said, you just ask. We can also promote lifestyle changes like drinking hydrating fluids, eating fibrous fruits and vegetables, moving around throughout the day if possible, giving yourself time in the bathroom, trying to have a routine. We discussed fiber supplements, stool softeners, laxatives, enemas, and suppositories. And lastly, we talked about colonoscopy preparation.